I wash my hands after I use the toilet. I wash my hands after I touch the animal. I also wash my hands after I cough. I wash my hands before every meal. I wash my hands after I sneeze.
Hand washing reduces the spread of germs and diseases. Wash your hands before you eat or touch food. Together, let's make hand washing a habit.
Clean hands, good health. Yay!
This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Good evening. Welcome to Simpson at 8. COVID-19 has presented enormous social challenges for the country as many people lose their jobs or work on reduced hours and reduced pay. How has this impacted our social welfare programs and social safety nets? Joining me this evening to discuss social welfare issues facing the country is the Director of Social Welfare, Rupeni Fatiaki. Mr. Fatiaki, thank you for joining me on the show.
Yeah, thank you. Yeah.
So, what's the impact of the pandemic on the social welfare services in the country?
I think yes, we are beginning to see cases coming to our offices requesting for assistance. We have calls coming in again, requesting for assistance. Where families have lost jobs, and so they're struggling with the with the current the day-to-day living. So yeah, we expect to see the numbers increase in the next couple of days and weeks as we progress.
So how do you look? Would you see the ministry being able to cope and care for these ones? Because these were not the poor before. These were people who are not covered in your program. Yes. These are people who've lost their jobs and are now coming into a scenario where they can't feed their families, can't pay the rent, can't do these things.
Mm-hmm. Yeah, we are beginning to see that, and I said, we are currently, working with, Ministry of Economy, on, because this, as you mentioned, these are different category. At one stage they were earning, they were working, and now, because of what has happened, and so they have lost their jobs. So, we need to be looking at, if there's going to be any assistance, it will be something different from our current
from the current programs that you have, because it doesn't cover them. Does it cover them?
Not really at the moment, because
really you're not wired to look out for this kind of
scenarios. Yes, yeah.
So you'll have to look at something different.
So we'll have to look at something different again. But at the moment, we have organizations out there in the community who is providing the food packs and that type of assistance. But this is going to be an ongoing issue, and so we thank people for the initiative to be able to provide it. But we need to look at sustainability and how long we'll be able to assist them.
And if something happens, it won't be just social welfare. It'll be like a whole of government approach. You'll have to work with other ministries to try and cater for this.
Yes. I think that's very important, and I believe there are other ministries who are looking also on the same situation. And I think agriculture has a program providing seedlings, encouraging families to do backyard farming, just to help.
So everybody's going to have to play a part to try and addressing this new scenario. But at the moment, did the social welfare have provisions for those who are unemployed? Was there some unemployment program that you had?
At the moment, we have our current programs. There are several programs that we offer, and one of that is the poverty benefit scheme. And so this program is tackling the poorest of the poor, and so it's inclusive of those who have not been employed, families are poor, and these are the poorest of the poor. And so this program, the poverty benefit scheme, targets such households.
All right. So I want to talk about that. So let's talk about the poverty benefit scheme. I'd like to go through some of the programs because it's important now for people to know what's available. And many people never looked at these social welfare programs. People also have their pride when they were working. But these are targeted to, as you said, the poorest of the poor, those who find it hard under normal circumstances. But so we look at this poverty benefit scheme because there's quite a few schemes and they target different areas of poverty and of the vulnerable in community. So this poverty benefit scheme, these are for family, for households, right? How does that work? Who qualifies?
Yeah, the poverty benefit scheme targeted households. So a family can be one person, one member in the household, or the maximum that we give for a household members is 4. And so this 4 is the number of maximum for 4 in a household. We have taken it from the household expenses survey that was conducted, and they say in average Fiji family is 4 to 5. And so you take 4 as the maximum number. So a family can receive, if one member family can receive $35 per month, and then added on that is a $50 food voucher. Okay. So they get an $80. But for the maximum, in the family of 4, they receive $127, $50, and then adds that they have.
So what if it's a family of 6?
Family of 6, we only take 4.
Okay.
Yeah.
So family of 4. There's a family of 6, but 4 people can get
accounted. They're included in the.
So how much the maximum for a family?
The maximum for family is 170. That's 170, 72 inclusive of the food voucher program that.
172. So that's minus 50. So 127 cash.
Yes, cash
per month.
Per month.
Which is around $30.
$35
per person.
Yeah.
So 127 plus $50
food voucher.
For the food voucher. So that's the poverty benefit scheme. How is that working? How many people are on this program?
At the moment, you have 25,000 plus people on that program.
I see 25,400. So
yeah.
So who qualifies for this?
So like I say, this the poorest of the poor. So the process is that they will come and they will apply, and what we do is we look at, there's a system that we have a system where we look at their income and the earnings, and also we look at the proxy. We refer to it in social protection circles. Proxy means testing. We're not only looking at what you earn, but we're also looking at your assets. And
which could be their what?
It could be like your house, house that you living in, and so it's different between.
What's inside your house?
Yeah, if you have those white goods, like TV and electricity. So it's different between rural and urban areas because it's in urban areas you may not have those those white goods, but you may have land, you may have
so you take that into
livestock, account. And so the scoring is different between the groups, and it'll give you a ceiling. The scoring will give you a certain ceiling. That says if you are below that amount, then you qualify. But if you are above that amount, then
so
you don't
can
qualify.
you be working and still qualify? Or is this for people who don't work?
Well, again, it goes to the system how it's assessed, and so some people may be like seasonal workers, right?
Right.
Some of them may be cane cutters, some of them may be just laborers, and so again, we will take in the applications and then we will put it in, and then the system will.
So seasonal workers.
Determine, yeah.
Before we go to the break, I want to talk about the other one so we can distinguish. There is the poverty benefit scheme, which we've just discussed for households. And there is the care and protection allowance. Yes. Correct. So what's the difference?
The care and protection allowance is targeting children in poor households.
Okay.
And so the target is single parents, mothers, single fathers, because we have come across cases where single fathers are looking after their own children. We have one of the common things that we have in our communities is grandparents looking after their grandchildren.
That's right.
We have relatives looking after nephews and nieces, and so this assistance is targeting those children.
So they qualify.
They qualify. Yeah.
So basically, obviously, the application is done by the single parents.
Yeah.
So those who have both parents, they can apply.
If both parents are there, then they can apply for the first one.
Right, for the right.
Okay,
so this one is for the single.
Yeah.
Single mother, single fathers, care and protection allowance.
Targeting children. Yeah.
So it's again monthly.
Yeah, it's monthly. Yeah.
And same amount.
Same amount. Yeah. Difference is the primary. The child that is not schooling is I think 29, and then you have 35 for primary and 40 something for secondary school.
So-
So it's again it's looking at 4 children.
Okay, 4 children. So 4 children can
yeah,
be
can
covered.
be- yeah.
So you're looking at that. And also get the food voucher for
They
the...
also get the food voucher.
All right.
Yeah.
We're with Director of Social Welfare, Rupeni Fatiaki, discussing social welfare programs that are available to people right now. Don't go away. We'll be right back after the break.
This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Bula, I'm Charlie from the Child Helpline. Life can be pretty fun for us kids, but sometimes it's not fun, and things can happen to us that make us feel scared and alone. At the Child Helpline, there's someone waiting by the phone right now. Yep, right now, for you to talk to. So give us a call. We're here to help.
At the Child Helpline, we're here for you. No matter what you're going through, anytime, day or night, call 1325.
That's 1325.
This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Welcome back. You're watching Simpson at 8. We're with the Director of Social Welfare, Rupeni Fatiaki. Now, Mr. Fatiaki, before the break, we talked about the benefits available to households, basically households with both parents, family of 4, what they are eligible to, and then the single moms, single dads, and what they can access. So, the poverty benefit scheme, you said there's around 25,000 plus.
Yeah.
What about the care and protection allowance?
It's about 8,000.
8,000.
Yeah.
So that's quite a lot of families.
33,000 altogether.
35,000. Now, another vulnerable group that I'd like to get to is the senior citizens, the elderly in our society, because they're a vulnerable group. They're vulnerable now to COVID-19. Obviously, they're vulnerable even without COVID-19, and we're facing a social situation where people are finding it difficult to take care of their elderly. So you have some programs covering the elderly. How do they work, and what's the program?
Okay, the program that is targeting our senior citizens, it's called the Social Pension Scheme. And so it started, I think, 2014, yeah. And we started with the age of 70 and above. The criteria is, if they don't have any source of income. And one of the reasons why, this program came about is because previously when we had the family assistance scheme, the old persons, so the elderly is included in that. And then we discovered that, they were staying with children and grandchildren, but, they never benefit from the...
Right.
And so we have complaints coming to us and saying, well, we are receiving, family assistance, but,
There's nothing going towards the elderly. So
yeah.
let me just clarify here. So there was the family assistance scheme
Yes.
previously, before the social pension scheme.
Yes, yes.
Now the family assistance scheme, before the senior citizens were in it, now you've taken them out and they have
Yeah,
their own
yeah.
their
Yes,
own program. Okay.
yes.
So you're saying they used to be 70, now it's 65, I understand.
So we have dropped it from, we had dropped it to 68, then we dropped it to 66, then we dropped it to 65. But when the program commenced, it was 70. And so now it's 65 for anyone who, any old person who have no source of income. And again, it's targeting, these old people who have, who are now old, living with families, but they don't have the support. And so they are not recipients of NPF, they are not beneficiaries of the ex-serviceman fund insurance, and so they qualify for this. And so it's $100 a month for any old person.
Right.
And at the moment you have 45,000 plus.
That's quite a lot. And I was going to say that because one would say many people old people in the country don't have a source of income.
Yes. I think we have, it benefits, a lot of our old people who are living in the villages,
Rural areas.
and in the maritime area. It's because these are the old people who have, all these years they have never worked, never earned any income.
No FNPF.
No FNPF, and so they benefited, from this program.
What about those that had the FNPF, have used it all,
Uh,
and then they left with nothing?
Yes, we have come across cases where People will come to us and say, we used my FNPF to pay for my pay
House.
off my house, send my children to school. And so in those, it's a case by case, situation where we'll ask them to, provide us evidence from FNPF to say that you have withdrawn your money and there's no zero balance there, and receive. And so we look at each case.
So this is regardless if the children are working well or if they get remittances.
Those are these are the kind of If we find that they have been supported, some of them have regular remittance, so it's a source of income. So through the interviewing process, we ask all these questions. Yeah.
Okay. Yeah. So would you say our senior citizens are well covered?
Well, I would say if you're looking at the number of old people, I was just looking at the figures in 2017. 60 and above is about 90,000. 60 and above.
90,000
old people at the age group 60 and above.
60 and above, yeah.
So we're targeting 65 and above, and we're targeting, now we have 45,000.
Almost half of that.
Yeah, if I'm correct, the number of 65 and above is about 50-something thousand. So it's almost like we're covering
almost everyone.
Almost everyone within that age category. There's about a difference of 10,000 to 10,000 plus.
And they're all eligible.
Except for those, like I said, who are pensioners, who are recipients of the ex-servicemen, and some people who are businessmen who have a lot of money, old people. They don't apply. They don't apply for this. So maybe that's the group.
So old people cover. Then we also, and this is very important information for the public right now, because as again, many people probably didn't. They were working, they never knew these things, so it's important that these programs be made aware of to the public. Disability allowance, you also have that for the
the disability allowance, again, it was part of the family assistance, part of the category. And so with the reviews done by World Bank in 2013, so we say, the recommendation, we need to separate and have a allowance or assistance for old people. We need to have one for disability. And so when the Disability Act, Rights of the Persons with Disability Act came about, that is when this allowance came about in 2017. So it targets pure persons with disability, so it's a $19.
So generally the vulnerable, and I noticed the numbers, it's over 8,000 people.
It's over 8,000,
Now, just to be clear, you can't have access to two, the pension and the disability. It's one of the other, right? Can you have access to both?
No, you cannot. If say, for example, if an old person about the age of 65, and you have, you disability, you can only take one. Yeah, right. You cannot take both.
But they're more or less the same.
Yeah.
I also noticed, and again, a lot of this was new to me as well, when I went through what's available for people, and I saw these 10, 11 programs that you have. So I felt it was important to go through this. You have the expanded food voucher program for pregnant mothers. What's this about?
Okay, this program again.
This is different from the.
Yes, it's different from the others. This one is targeting our, the mothers, pregnant mothers in rural settings, in rural communities and in the maritime islands. And so it came about, after it was highlighted by Ministry of Health that our mothers, pregnant mothers in the rural and maritime areas, are not coming for clinic on the appropriate time. So they are coming in late stages of their pregnancy. So when they come to for time for them to give birth, there are complications. And so the program came out to encourage young mothers or pregnant mothers to come early for clinics for them.
So this is for any pregnant mother, no matter the age?
No, there's 3 terms. 3 terms meaning that 3 pregnancies. Okay, so first, second, and third, you can be assisted.
Oh, for 3, you mean for
3 terms of pregnancies,
So 3 children, getting 3.
One of the...
no, but what I mean is any pregnant woman, whether she's 19 or...
Yes.
Does it take into account whether they're working or the status?
Except for the civil servants who are working in rural,
not the
nurses and the
teachers.
teachers.
They don't
so
apply.
they're exempted. They exempt. But apart from that, all the other pregnant mothers that are living in the
So that $50 per month, basically from the first month, once they show that they're pregnant,
yes, if they come and register in the first month in the health center or the nursing station, so we take it from that first month, full 9 months plus 1 month after birth. But if they come in halfway, then we take it from the time they register.
So are many pregnant women taking advantage of this?
Yeah, we've seen an influx and increase of the trend is going up. We are, at the moment, I think we are 30,000 plus.
30,000?
30,000 plus pregnant mothers on our program.
Currently
on the program, yeah.
All right. I just wanted to go back on the social pension scheme, and because we're having an aging population, and studies are showing that we have people getting old, and quite a bit of people will be, you and I included in the next year, will be reaching into that category, senior citizens. And we see the difficulty. Money is one thing, but these people need care. It's just so looking at the situation of homes and how the old people are looked after. Those that some issues with not wanted by the family or a burden to the family now, and they go into homes. Does the social welfare department look into this?
Yes, the 3 state homes, these are the old people's homes. There's one in Samambula and one in Lambasa and one in Lotoka, which used to be under the Ministry of Health. A couple of years ago, it was transferred to the Ministry of Women, and it comes under the Department of Social Welfare. And yes, we have seen an influx of applicants coming, from families, children wanting to place their.
So the applications are made by the children?
Yeah, place their elderly parents in the homes. And we have a waiting list. At the moment, we have about 134. Yeah, 134 old people in these 3 different homes. And again, we have seen a trend. I don't know whether you'll notice or on the streets, you'll begin to see old people sitting on the streets now. This is a trend that you'll begin to see, and then when you interview and you do profile checking, we find that some of these people have children. And now they have been pushed
aside
or
pushed away.
They're seen as a burden, and I think that's a sad thing to when a society comes to the stage when they start pushing the old people, the most vulnerable, and looking at them as as a burden and access to, and I think that's but we're seeing an increase in that.
So what's the number like on the waiting list?
I will not be able to give it, but I think it's almost every day, every week we have.
You're getting the applications,
and we have to tell them,
So this is something we've got to plan towards.
Yes.
And I think another of the issue that's been discussed is how some talk about how we need to improve the situation at the old people's homes, because you have in some of the places the mentally challenged, the disabled, and the old people who are okay. All together in one home. Would that be correct?
Yes.
Is it something you're looking at?
I think that is true. I mean, we have in our homes right now. We have old people who are normal, which is old people's home, and we have cases where mentally challenged, and we have cases persons with disabilities. Unfortunately, we don't have the facilities to cater for the other 2. Categories. And so when it comes to situations like that, if a person with disability, is thrown out of their families, we have no option but just, to take them in. And then we have a case, and we come across this.
Because there's nowhere else for them to go.
Yeah, and we're coming across this, it's becoming more frequent now when families will admit their members to St. Child's, because of mental situation. And when it comes time for discharge, they're not there.
Right.
Same, they'll admit their elderly parent or old persons in the hospitals, and then come time for discharge, they're given a false information, false contact number, address, names, and the old person lies in the hospital for a month or 2, and the Ministry of Health calls us and say, we have a person here lying. We cannot find.
Take them off our hands.
Take them off, because we need the beds. And so in kind of situations like that, we cannot do much, but just take them in, because there's no other place for them to go.
And that's the issue. I'd like to, we're out of time for the second segment. Would like to explore about the streets.
Yeah.
Because these people are either ending up on the
Yeah.
streets, if you don't put them in
Yeah,
the homes
yeah,
that
they
you
will
have,
end up, they end up in the
facilities.
streets. Yeah.
Something interesting to think about this evening. You're watching Simpson at 8. We'll be back after the break.
This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
I wash my hands after I use the toilet. I wash my hands after I touch the animal. I also wash my hands after I cough. I wash my hands before every meal. I wash my hands after I sneeze.
Hand washing reduces the spread of germs and diseases. Wash your hands before you eat or touch food. Together, let's make hand washing a habit.
Clean hands, good health. Yay!
This program is brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Welcome back. You're watching Simpson at 8 with the Director of Social Welfare, Mr. Rupeni Fatiaki. We spoke about the poverty assistance. We spoke about the programs that are there for women, for the elderly, and I'd like to talk now about the children. What's there for the children?
The children, yeah, we have the scheme or the assistance for the children is the Care and Protection Allowance.
Oh, that comes
Yeah,
right.
but
Okay,
yeah,
sorry, we
but
talked about.
part of our work, just let me briefly, explain the different work responsibilities that we under the Department of Social Welfare. The first programs that we were talking about, these are the social protection programs. And
Right.
so it's money that government gives to assist families, poor, vulnerable groups.
Just to ensure they got something.
Yeah, and so it comes under our family service unit. It's a unit that it's under me, based on the headquarters. And apart from the social protection programs, we have the child protection unit. And so this is our legislated responsibility by law. We are responsible for the protection and care of children and kids. And so the Juvenile Act is the main legislation that we work with. And in that act, it gives the Director of Social Welfare the powers to remove children in an environment that is unsafe, abusive, and so
Neglect.
the process is that we go to court and then we file a case in court.
All right, so you don't just go.
Yeah, we go to court and say this is the case. You present the case to the magistrate and say this child needs to be removed. And so we apply for a care order, and so the magistrate issues the care order and says, no, this child will be under the care of the Director of Social Welfare.
Okay.
And so it will depend on, it can be for months, it can be for years until they turn 18. And so that's another role that we play, and so also the children in institutions. Many people in the community are aware of Dilkusha Home, St. Christopher's Home. So these are homes that look after children. Children have been abandoned, orphans. And so all these children, there is 173 children. There's 9 homes all over Fiji for children. And
173 in all
homes. Yeah. There is 4 here in Suva, 4 in the west, and 1 in the north. And so there's 173 children, and all these children comes under the care of the state, which is Director of Social Welfare, is the legal guidance for all these children. And so government provides funds for the upkeep and care of these children in the institutions.
How regularly, how often, circumstances in which you have had to go and take children from their family? Like, give an example. It's
very regular. It's quite often. We get calls even in the night. If it happens, there's an abusive case, and so we get. Our officers work 24/7. And so we will have to attend for those cases. If we need to remove the child in the night, we'll have to do that. We have cases, every week there's cases that come in from all. And then we have, children that, are abandoned in the hospital.
Right.
The mother comes in to give birth, gives a false name, a false contact. And then gives birth and say, I'm going to the toilet, or I'm just going outside, and disappears.
So we have that happening.
Oh, it's common.
It's common. Amazing. And so then you choose which home they go to.
Yes, and then we take the child and then we work with the home and say, okay, Dilkusa, St. Christopher's, and a couple of homes in the west. There's 3 homes in the west that take in babies, and children, toddlers, and there are homes that only take, children that are at certain age. And so we call the homes and say, do you have space? And we have a child, and so we work with them, and then we transport the child, we place them.
So these things are happening in society.
It is.
That's your job to handle that, and it's happening frequently.
It is. We have cases. We reported in the media a couple of months ago, a child that was found in the bus. A couple of weeks ago, the child was found in the bush. All these cases that appear it comes to me.
And we're seeing situations now with the pressure on parents,
Yes.
people looking to jump off.
Yeah, the case on the
many
weekend.
Many times the kids are
yeah.
left at home and left abandoned, so to speak. So there's also the scenario looking of increase in juvenile offenders.
Yes.
How is the situation handled by your department?
Yes. Again, one of our homes, out of the 9 homes, one of the homes, and I think people will be aware of this, it's called the Boys Center. And it used to be Nasino, where the Army training camp is. It used to be approved school. Then we moved to Olbe, and now we are in Lakemba Street. But this home is fully funded by government, and it is for juvenile offenders.
Right.
And so at the moment, the capacity that we have, it's in Samambola, we only have a capacity of 20, juveniles that we can keep. But we're seeing, again, an increase of, cases coming. And then recently, with the COVID, curfew, we have a lot of teenagers that have been taken into custody. And so, they're not with us, to the states where, we had to tell the magistrates, our home is full, so you need to look at other alternatives.
For them,
Yeah.
So there's a boys' home, there's no girls' home?
Girls' home is in Mahafi, it's called Pearly Gates. And so it's in Mahafi, but you seldom have teenage offenders.
Offenders, okay. So it's mainly with the...
And so we have cases who are, teenage girls who are victims of sexual abuse and violence. Yeah.
Sadly. Yeah. Now, I'd like to talk about the streets. People are talking about seeing increase in beggars. And I noticed in some of your reports, in some of your papers, you're seeing a variety of, you've categorized these beggars because there's all kinds of beggars. And maybe you'd like to explain about how you see the situation of begging in the country.
Yes, we have, part of our role is to look at the beggars. You have a unit that does that, and we have officers in all the divisions and districts where they profile cases. When beggars are issued, they go and do their rounds on the streets, and they profile cases. I think we profiled about 400 plus cases, and these are not all beggars, but people that happens to be on the streets, and then so they take the profile. Whatever they're doing on the streets, we take the profile. You asked the question in the early meeting, how many child beggars are there? And I went back and checked our records. It's 42 that we have recorded.
42 child beggars
that we have recorded. And so, these children, when we do the profiling, and we find, most of these children have families, And some of them, sadly, it's the parents who and you see some of them selling. The mother city is a good example because a lot of people bring that up, In the nights, you'll see a lot of teenage, boys selling roti and selling, and hanging around, loitering around the place. And so when we are called, we go and do profiling, and then we go, and then we discover that, some of them have families, their homes, and I think the sad part is that, sometimes, and I think this has been highlighted over and over again, where parents don't have the time.
All right. So when they come, some of it's organized by the parents for them to come out.
Sometimes, yes, it's the parents who, who tell them to go and sell,
and beg.
And sell and beg, And yes, that's what happens in some cases.
So one is these child beggars who are used by people who obviously there's some business, there's some element brought to it. There are the professional beggars, I think that's been profiled previously. But also there's also the mentally challenged, as we discussed earlier, who are ending up on the streets because no one's taking them in. And the homeless. And that's something we really have to be putting our hand on a pulse on to monitor.
Yes, yes.
How do you take someone out?
See, professional beggars. I said, professional beggars. There are two types. There are those that have homes. They're dropped in the morning and they're picked in the evening. Then you have those that live on the streets. They beg. I used this story. I come across. They will be begging you, wearing, rags. And then at one time they will change. And I've seen this, a couple of times. I know some cases where they will put on, normal clothes, and you'll never even recognize them.
Never recognize that they were the same person on the streets.
And so, the problem with these cases is that, some of them prefer to be there. As I said, we have profile cases, and we come across cases where there's family, right? And then the cases where they don't have family, we try to place them in the homes, institutions. But then, like I said, they spend most of their time on the streets, and so when you try to put them in an environment where it's restricted, regulations and rules to follow, a time to sleep, a time to wake up, a time to eat, they don't like those boundaries. And so you put them in, and the next moment, next day or 2 days, they find them back on the streets.
Okay.
And so those are the kind of situations. And I mean, a lot of people now raise the question, what are we doing about these cases? I mean, these cases are well known to us.
Okay. and that's interesting. Now, I just wanted to go, we've run out of time, but I want to discuss this aspect because people talking about that we are looking after quite a big number of people. 45,000 on the social pension scheme, 25 on the poverty benefit scheme, 8,000 the CAN protection allowance, so disability allowance another 8,000. So quite a number, almost
80,000
80,000 plus are being looked after by the social welfare department. And the question, I just look at it from the other way. Maybe people look at a harsh look at this. Are we becoming a social welfare state, creating this dependency syndrome?
I think if you look at these cases,
because you have the free bus fare.
I think it is important because I think a lot of these people are genuine and need to be assisted. But there are the elements that will try to take advantage of the system.
Right.
And so
it's not a simple thing; it's a very complex.
Yeah, we've come across cases where we have people who try to take advantage of the system where they would apply with different name in another district, and then they'll come to another district and apply with a different name. And so those are the kind of things that they do. And so we have. It's important, the two programs, the poverty benefit scheme and the CAN protection allowance. These are temporary, and I just want to make it clear, these are temporary assistance.
Okay.
It's not supposed to be
not
permanent.
Supposed to be going on for life.
Unlike the household, right? I mean, the individual. If I'm 65, I turn 66, I turn 67, I still receive until I die. Same with disability. But for the two first ones, the household target ones, it is government gives the assistance to the family in their time of need. We assess that, yes, you are genuine, you need to be assisted. We assist you for the time with the intention and expectations that while government is assisting you, you should be also looking for other means.
Not sitting back, you should be looking to...
Yeah, and so we have other programs that like the graduation program, we will help provide seed funding for them to engage in small businesses. And so once they're able to get back on their own 2 feet, so we withdraw the assistance. And so we give it to another family who is in need.
But that's not happening much, right?
Unfortunately, it's very difficult, when we try to withdraw, people
start complaining.
But
you have programs that to give them money up to how much to be able to start some business?
The maximum that under our graduation program is about $1,000.
$1,000.
Yes, to help
so as to start their business and get off.
Yes, and so as they build their capacity, they can venture into other. We have Fiji Development Bank who offers, and so as they build their capacity, they can go for other institutions where they can continue to to.
Final question. This is COVID-19. Seeing people are no longer employed. A lot of people have lost their jobs, and a lot of people with goodwill going around. Food packs giving it to people. There should be some things that they verify, right, about whether these people are under your programs. And we're seeing. We talk about begging on the streets. It's almost there's some element of that going online. These are some new dynamics that we're seeing with the advent of COVID-19.
Yes, I think what you're seeing is that with the COVID-19 we see a lot of genuine organizations coming up wanting to assist and help, which is good, and it's important that we assist. But I think the important thing is that we need to be able to coordinate with the relevant stakeholders to ensure that the genuine people are assisted, and it's directed to those that really need the assistance. Because there are a couple of organizations who are giving food packs and this. What is their criteria? What is their validation or verification? Some of the recipients of the beneficiaries of those people might be recipients of ours, who's receiving the monthly allowance and the food voucher. Now, that can be given to a family who has not received anything from us. And then there is the possibility of people double dipping. They can go to this if the verification is not really tight and clear. They can go and access it from here, then go and access it from the other one, and then they get this assistance 2-3 times, and yet there are those people who are genuine
at the cost of the others.
Who are not able to benefit from it or to be assisted. Because we saw this experience in the past, Winston experience, when we were out there in the field and we saw this, this happening. So I think I would encourage that, there is coordination and talking together so that we're able that, we really gave it those that genuinely affected.
Coordinate and verify. Director of Social Welfare, Rupeni Fatiaki, thank you for joining me on the show.
Most welcome.
Punaka. That was Simpson at 8 for the evening. Join me again next Thursday at the same time. Good night.
This program was brought to you by Colgate. Brush twice a day for strong, healthy teeth.
Has something ever happened to you that made you feel scared or alone, but you didn't know what to do? Talking to someone is the best place to start. It could be a teacher, family member, or a neighbor. It could also be the Child Helpline. All you need to do is dial 1325 and you can talk to someone who can help.
With the Child Helpline, we're here for you. No matter what you're going through, anytime, day or night, call 1325.
That's 1325.